Good morning, and welcome to this edition of Medical Minutes, brought to you by Passavant Hospital. I'm Dr. Peter Russotto, your host and moderator. Today's topic is updates for the Center of Psychiatric Health. Here with me in the booth is a new member of the medical staff, a psychiatrist, Dr. Handa. We welcome her to the community of Jacksonville and to our medical staff. I'm going to ask Dr. Handa to tell us a little bit about herself.
Thank you for the welcome, Dr. Russotto. My full name is Kamna Handa. I actually am a graduate of the Southern Illinois University School of Medicine, Department of Psychiatry. I did my residency training there in adult psychiatry and did my fellowship training in child psychiatry. And now here I am in the community of Jacksonville. Joined the Center for Psychiatric Health in the month of July. I've been really overwhelmed with the kind of welcome that I've received from the community. This community has been really supportive.
I'm sure you're very busy from the first day on, right?
Absolutely.
What should the listening audiences know about the Center for Psychiatric Health here in Jacksonville?
Well, the Center for Psychiatric Health, I think, is in a very rapid growth stage. I think to begin with, we had mainly telepsychiatry services. Up until a few years back, I think we were doing some face-to-face contact too, but in the last few years, it was mainly telepsychiatry. But last year, Dr. Basnet joined in and started delivering the psychiatric services in the form of medical management. There were already therapists that were doing that. And within about a period of 1 year, I have joined the center, and we are actually actively looking for a third psychiatrist to join us. As soon as we can find one, we want them to start because the need in the community is just huge, and I think this had been underserved for a long time. So the center has been focusing on delivering services in the form of medication management as well as providing psychotherapy to the patients with mental illness.
So your range of services is also, though, for child and adult psychiatry?
Absolutely. So we are seeing anyone from, I think the youngest I've seen so far is a 3.5-year-old, and the oldest I've seen so far is about the age of 92. So yes, we provide services to children, adolescents, adults, and even geriatric patients. And
basically it's probably by referral only, correct?
Absolutely, but there have been some walk-ins too, and some of the clients want to self-refer themselves, so they fill out some paperwork, and those referrals are looked through and screened, and then determined if those are appropriate referrals and can be put on schedule.
So basically, though, the best way a patient could be plugged into your system is to talk it over with their family physician, get a referral, and then they would refer them to your services at Passavant.
Absolutely. That is the best and the quickest way, though with the overwhelming response in the community, I think we have been backlogged somewhat, but we are hoping that that'll resolve to a certain extent as soon as we have a third psychiatrist on board.
And you are actually located in Passavant Hospital, is that correct?
We are on the southeast corner of the hospital. We are not part of this main building of the Passavant Hospital, but we are on the same campus in the southeast corner.
So you were in the old Dr. Olenek office, is that correct?
That is absolutely correct. And I would like to add here that as of last month, which was September, Dr. Olenek has moved his office with the rest of the OBGYN department, and as of January 1st, we should have the entire building available to the Center for Psychiatric Health.
Well, you're already hitting on one of my next questions. You're talking about expansion. What are some of the big expansion things that you can anticipate in the future about the Center for Psychiatric Health?
Well, the biggest expansion that we are looking forward to is actually the start of our inpatient unit at Passavant Hospital. The work for the inpatient unit has already started, and we are anticipating that it should be complete and we should have our unit running somewhere around April-May of 2016. We would be providing services to adult inpatient clients only. It is not going to be providing services to the child and adolescent population as of at this point of time. We will be a 10-bed facility. That is the approval that we have received. that is one of the biggest expansion plan. And as I said, we are in the process of actually hiring a third psychiatrist. So that would mean actually expansion of the outpatient, which would also mean that we are looking for another therapist. So we will have more number of providers providing the same services.
Very exciting. And that's actually kudos to you and Passive and Hospital, because in order to expand, people don't understand you actually have to go through Department of Public Health and get certificate of need. And we are certified for 10 beds, probably going to look into the future maybe to even expand it more. But there's a critical shortage of beds in the state of Illinois, correct?
That is absolutely correct. We anticipate that the approval that we received from the Department of Health for 10 beds is going to change. We would move that request to a bigger number pretty soon based on the need for the community and the surrounding areas.
Yeah, that's definitely a big need, because sometimes now patients with psychiatric problems are waiting for a bed 2-3 days, and they're actually just being held, and sometimes in a swing bed or actually in the emergency room, correct?
That is correct. And sometimes they have to be taken to the medical floor because they're concerned about their safety. And so they're providing as much care as possible. And then, of course, they initiate a mental health consultation with us if there are any acute safety concerns. But yes, you're very right. We are in acute need of having those beds.
And when you talked about future services, you guys right now are actively recruiting, you said, for another psychiatrist. Best case scenario, probably that wouldn't be until next summer when their residency is over, correct?
We actually have one person who we are hoping will give an answer to us in the next month or so, hoping to have someone start actually somewhere in the beginning of 2016.
Wow, that's exciting. Very good. Any suggestions to improve the identification of mental illness?
Well, as I've been dealing with clients here, I'm actually amazed that people have been really looking and watching out and seem to seek help. But still, I would like to mention that if any of your loved ones just seem to be not being themselves, please reach out and find out what's really bothering them, because I think that is the biggest piece that keeps missing. I see clients whose family members start to say, looking back, things started about 2 or 3 years back, but we thought, okay, you know what, let's let it go, it'll change. So reach out to your family members, provide them with the support, ask what they need help with, and it's not wrong to seek mental health help from a mental health provider. So bring them in, particularly if you're seeing any signs of them being withdrawn, isolating them, having signs of any irritability which is just not explained by, their situations, or even if it is explained by their situations, if it is an exaggerated response to their situation, I would suggest that make sure that you talk to at least your primary care physician, who can then guide you and see if you really need the help from a specialist.
Yeah, some people just totally withdraw socially, and that's just one of the first signs of some type of mental illness, is total withdrawal, not willing to go out or socialize with other friends or family, correct?
Absolutely.
And I know you talked about when to seek help. Probably for your idea, you would say it's never too early to seek help.
Right.
Okay, Dr. Handa, do you have anything else to add that you'd like the listening audience to get away from this conversation?
The one thing that I forgot to mention with regards to our updates, we now have a behavioral health consultant who is actually a therapist who is working with the Memorial Physician Services right there in their outpatient clinic. The purpose of this person, and this person's name is Zach Whitman, the purpose of this person is for him to provide support to the primary care providers should they notice any mental health issues that come up in screening. They can ask Zach's help for him to come in, talk to the patients, and really determine the extent of problems and make appropriate recommendations, whether directing them to resources, community resources, or directing them to seek help by seeing a psychiatrist and things like that. In general, just being the consultant in a primary care physician's office where majority of our patients with mental illness are treated.
Well, thanks again for that great information, and welcome again to the Jacksonville community. And Thanks for being with us this morning. Thanks for listening to the listening audience, and good